And here's what the report came out with. The distribution of health expenditures in the U.S. population showed that 5% of the U.S. population accounted for 50% of all the healthcare expenditures. Furthermore, 1% of our population accounted for 22%. And those individuals in those two groups, on average, had an average spend each year of $116,000 to $37,000 in healthcare expenditures. On the other side of our population, 50%, half of our population, only accounted for 3% of the entire healthcare expenditures. And on average, they only spent $300. What does this mean for your health insurance and what your options are? So here is how I like to explain what this means for you. Through your insurance company for your car, you have auto insurance, and those companies have to insure the good drivers with the bad drivers. If they only insured the bad drivers, they couldn't sustain business because of the amount of the claim losses that they would have from those bad drivers. They have to have good drivers paying premiums into the same system as the bad drivers. And this is what's happened to our healthcare industry. 5% are driving 50% of the expenditures. 50% are driving 3% of the expenditures. The Affordable Care Act forced individuals into plans for the benefit of the insurance companies. When it was passed, 92% of our population were in these plans. Things have changed, and the political environment has opened the plan back up, but it's still in existence, but just without enforcement. But here's what this means for us. When those plans were put into place, and they're still basically the standards that are out there now, individuals were paying high premiums for high deductible plans. Typically, those high deductible plans were anywhere from $5,000 to $6,000, $7,000, or even more. Well, the Brookings Institute did an interesting analysis as well on what is the real distribution of out-of-pocket healthcare expenditures. And they found that 1 in 50 people, 2%, spend more than $5,000. 1 in 200 people spend more than $10,000. But here's the interesting thing. 1 in 7, 14%, spend a big donut, spend $0. So these individuals who were forced into these plans have to pay a high premium for the benefit of someday getting the insurance coverage they want when they spend their deductible of $5,000 or $6,000. And they will never do that. In fact, 1 in 50 only spend more than $5,000. Now you might be thinking, well, Steve, what happens if I have a major medical event? I want that kind of coverage. And I'm here to tell you, you have alternatives that will still cover a major medical event should it ever happen to you. And a lot of people think when that happens, the coverage cost or the medical cost is into the millions, and I'm here to tell you it's not. In 2017, when they did this analysis, 194 people had health insurance claims that exceeded $1 million. My name is Steve Stump. Ask me how I can save you 40 or 50% on health insurance with one of the best plans in the country. You'll have access to the largest PPO network, no deductible for routine care, and no copay or coinsurance, and the ability to replace your income while you are sick or injured. Contact me at the number or email below.